Hola, Santa Catalina, Panama. We're down here on a mission trip, and I wanted to come to you with some beautiful views, so I'm going to move out of the way and let you see the ocean. This is the surfer's break. This is where the rocks are and the best waves are here in Santa Catalina. There's several different ways to get to the beach, but this is more the more experienced surfers surf out here because there are rocks. The tide has to be correct in order for you to be able to be safe and surf. So I'm going to move out of the way, but we're going to talk about heart disease today. Oral systemic link, so mouth to body, heart disease, and how it all works together. So enjoy the view. I'm not standing under the coconut tree there right beside me because I don't want to get head with a coconut. So today we're talking about heart disease and oral health. You might be wondering, how are the two related? So if I have heart disease, how does that have to do with my mouth? Well, the whole body works together as one unit. And 30 years ago when I got to dental hygiene, it didn't really dawn on me that the mouth was such an important part of the body. We have learned that it really, truly is these days. So poor oral health. So if you don't take really good care of yourself, the bacteria get into your mouth. They lay along the gum line. If they're allowed to lay at the gum line long enough, they'll migrate down below the gum. So they're multiplying once they get in your mouth. You breathe air in, you get bacteria in. They lay at the gum line. If they're allowed to stay there long enough and we don't remove them by brushing, flossing, water picking, and all our daily home care routine, they can get below the gums. When they get below the gums, now they're bloodborne. So now they're going to your heart. They're being pumped to all parts of your body. And that is the interesting, intricate part of understanding the oral systemic link. What I found in talking to medical providers is most of the medical providers don't know or haven't learned as much about this and put it into practice. So there are some that are doing it, some that are not. So you as a patient want to be an advocate for yourself and learn as much as you can when you have a condition to see ways that you can help yourself. Because sometimes it's the subtle changes and the subtle things that we do that make the biggest differences for us. So understanding that the bacteria in your mouth gets into your bloodstream and now your body's trying to fight it off. It can lead to inflammation. Inflammation is the stimuli triggering your body to something that's coming in. So disease-causing bacteria come in. The body ramps up trying to protect itself. That's inflammation and the inflammatory response. And that causes all kinds of issues. Inflammation in the body is not good for an extended period of time. Inflammation is never a good part of the body. It causes other problems such as cancer. So bacteria that cause gingivitis is the inflammation of the gums. If allowed to stay there long enough, it'll get down into under the gums, which is to the bone and under the gums. That's periodontal disease. That's where you actually start losing bone support. So your gums are at one level, your bone is at another. The bacteria's been there long enough, so now you have periodontal disease, which is bone loss. That's your jawbone that starts receding away. Silently, but there. And so it gets into your heart. Now this blood-borne bacteria is down to your heart. And the heart's trying to stay healthy, but you've already got heart disease. So now it's really trying to work hard to stay healthy, pump blood to all the parts of the body that needs to. It can also contribute to atherosclerosis, which we also know, ooh, thunder. We also know that mouth breathing contributes to atherosclerosis as well. So be familiar with that. Connection is inflammation as normal. Inflammation is the problem. Chronic inflammation from inflamed gums is the gateway to the bloodstream. So please remember that. Inflammation is the body's response to stimuli, and that isn't a negative way. That is not ever going to be a positive way. So we've got to make sure that we reduce those bacteria causing infections that come from the mouth. Anything we can do in the mouth to make you healthier will definitely improve your whole body health. So we want to improve our oral care as a daily routine. We want to eat a balanced diet. You already know as a heart disease patient that you want to eat a good diet. It's important to get your fruits and vegetables in. Stay hydrated. That's not something that we talk about enough, is to stay hydrated. Make sure your body's got plenty of water so it can clean itself and heal itself. The body's miraculous and it can do these things, but we've got to make sure that we feed enough water. The other thing is stop smoking. That's vaping, smoking of any kind. That causes your body harm. It definitely causes the depletion of vitamin C in your gums. So if you are a smoker, you want to make sure you're taking enough vitamin C so that your body gets a vitamin C before the nicotine binds to it. So that's important. Signs and symptoms that you have inflammation and the gums are not healthy. If you have heart disease especially, you would see bleeding gums. With periodontal disease, if you have bone loss and that chronic inflammation of the gum disease, you would have bad breath. This bad breath is a different kind of odor. It's really a different kind of smell that you may or may not be familiar with. So if you're having bad breath chronically, not just in the morning when you wake up, but throughout the day, then likely you have some kind of periodontal disease, which is more imperative if you have heart disease. You would have receding gums. When the gums get inflamed, they get swollen, the bacteria go beneath them, start to eat that bone away. But eventually, if they start healing down a little bit, they'll start receding. So if you've got receding gums, you likely have had some periodontal disease. And even chest pains and shortness of breath, sometimes it's hard to make sure that what symptoms you're having is related to what. But if you have a shortness of breath and any of these other signs and symptoms, you definitely want to be mindful of that. So tips and tricks. This is the good news, tips and tricks. You've got to brush your teeth. You've got to brush 2 times a day, 2 full minutes with the fluoride toothpaste. You've got to get down below the gums. We're doing the dental missions here in Panama, in Santa Catalina. And I had one patient yesterday, young woman, was doing a great job above the gums, but below the gums, she had so much hardened plaque, so much tartar. Her gums are so inflamed. So we've got to be able to get down below the gum. If you can't floss, that's fine. You can water pick. You can use little green soft picks. You can use floss on a stick. You can use a little toothpick type instrument. So use something to get down below the gums. That is so, so very important. And making sure that you angle the toothbrush at the gum line so that you can brush along the gum line well and help disturb the bacteria. Brush your tongue or scrape your tongue. Your tongue collects bacteria just like your teeth do. So make sure you're cleaning your tongue well every day when you clean your teeth. Regular dental checkups are very, very important. Cleaning underneath your gums, which we already mentioned. Limit your sugary snacks. Anytime you put sugar in the body, that creates inflammation as well. So limit your sugary snacks. Make good choices. Choose sugar-free gum or use xylitol products to stimulate your saliva production. Your saliva makes minerals and it helps the mouth heal itself and keep it healthy. So your mouth goes through a mineralization stage every day after you eat any sugars. So 20 minutes is the cap on any ingestion of sugars, preferably. Right, so we talked about heart disease. We talked about inflammation. We talked about stimuli. We talked about bacteria. We talked about regular checkups. We talked about dental care. So I cannot stress to you enough how important it is daily home care. Just do a little bit daily. Do something today that you didn't do yesterday. Every step makes a difference for you. So we'll be diving deep into other systemic links. We've got diabetes, heart disease. We're going to do low birth weight babies, Alzheimer's, dementia, how all that works together. So Restart Hygiene, Becky Moore, like and subscribe. And I will see you next time, hopefully from Santa Catalina. Thanks, guys, for tuning in.